A new procedure is changing the lives of young patients who suffer from a debilitating deformity. ABC 7's health and science reporter Carolyn Johnson has a look at how it works.
I loved choreography and I loved dancing and just the energy and the dynamics of it.
Ballet had long been a passion for Sarah Grimes until her instructor noticed something that threatened not only her ability to dance, but her quality of life as well.
She always would tell me to stand up straight, and she noticed that I was hunched over a little bit, and so she asked me if I had scoliosis.
This is Sarah's pre-op x-ray, and you can see how much of a curve she has.
Scoliosis is a deformity of the spine that can leave even younger patients with a hunching of the back. In addition to bending the spine, the disease also twists it. Walnut Creek surgeon Robert Rovner specializes in treating scoliosis.
When a patient bends forward, one side of the spine is higher than the other. So the ribs get thrown up because the spine is rotated. The ribs get thrown up on one side. So if you think Hunchback of Notre Dame, for example, that's what created that hunchback. Okay, and then if you can bend just a little forward.
To straighten Sarah's back, Dr. Rovner turned to a technique he's helped pioneer that involves placing rods and screws in a new way.
Traditionally, you put in a left-hand rod and then bring the spine to the rod to get the correction. Then you put in a second rod, and that stabilizes it and strengthens the construct. But because the first rod is already in place, the second rod doesn't add anything to the correction.
He says with the new system, the hardware on both sides of the spine is interconnected. During an operation that takes a good part of the day, surgeons straighten the spine in sections, anchoring the hardware temporarily to the operating table.
When it's perfect as we can get it, then we put in both rods and tighten it all down. So in effect, we're correcting the deformity by using both sides of the spine, both sides of the instrumentation, rather than only half.
Vertebrae are then fused together to keep the correction solid. In Sarah's case, surgeons successfully corrected both the bending and the twisting of her spine, and she's hoping to regain the mobility to do the things she loves.
I'd love to be able to just get back on the dance floor and perform again.
Carolyn Johnson reporting. Now, although the procedure involves modified hardware, it's treated as a standard scoliosis surgery and for insurance purposes, and there is typically no additional cost. Now, if you want more information, we have a link on our website to the Spine Network of California. Just go to abc7news.com and click on See It on TV.